Hi, I'm John Wayne Buag, Section N15, Level 1. Today's video, I'm gonna demonstrate the vital sign. Vital signs are sociologic measurements of the neurologic, metabolic, respiratory, hormonal, and cardiovascular status of the body. They include the body temperature, pulse rate, respiratory rate, blood pressure, and oxygen saturation. These measurements are utmost important because they are the basis for identifying sociologic disturbances or even life-threatening health conditions. Thus, vital signs are monitored periodically. The first thing that I need to perform is the body temperature. It is a difference between heat produced and heat lost by the body, and it's measured through the use of a thermometer. First, you need to greet the client and introduce yourself and verify the client's identity. So, hello ma'am, I'm your student nurse today. So, karon mag-explain ko sa imong gamay procedure para mo-cooperate ka sa ako. When the patient knows what is to be done, she will cooperate better. Wash your hands or sanitize to prevent cross-contamination. To deter the spread of microorganisms, smoking or oral intake of the fluids can cause false temperature reading. Ensure that the client is calm and quiet as what the client did for the past 12 minutes. So ma'am, unsa mo gibuhat sa 12 minutes kanila bay?
Nagbakos-bakos, sir.
Okay ma'am, if the patient was engaged in a strenuous activity, allow 10 to 15 minutes to rest. Expose the patient's axilla by securely folding the client's shirt, sleeve, or gown up to the deltoid region. If axilla is moist, dry with the patient's towel using a patting motion. Remove the thermometer from the container. Cleansing from an area where there are few organisms minimizes the spread of organism to cleaner area. Friction helps to loosen matter from the surface. With the cotton ball, wipe the thermometer by rooting motion from the temperature sensor of the neck. Place the thermometer of the patient's axilla. Assist the patient to place the arm tightly across the abdomen to keep thermometer in place. And wait until the thermometer will buzz. Note, the result of the temperature note remain the holding thermometer in place if the client is irrational or is very young. Documentation provides ongoing data collection. And that's all. Yeah. The next thing that I need to perform is the pulse rate. Assess the client to a comfortable supine position or to a sitting position on a chair or at the edge of the bed to provide easy access to pulse sites, relaxed position of forearm, and slight flexion of the wrist promote exposure of artery to palpation without restriction. Select the pulse site point. Normally, the radial pulse is taken. Place the 2 or 3 finger steps, index, middle, and ring slightly and squarely over the pulse point. Never use the thumb and assisting pulse. Rest the arm in a 90 degrees angle across the abdomen with the palm facing downward. Observe the first minute the regulatory of the pulse count for 1 full minute 16 for 1 minute to 16. Note the pulse rhythm and volume. And that's all. Next is the respiratory rate. It is the exchange of oxygen and carbon dioxide between the atmosphere and body cells, and it is initiated by the act of breathing. The purpose of this is to obtain the respiratory rate per minute and an estimate of the patient's respiratory status. Feel the rise and fall of the diaphragm while supposedly taking the radial pulse. Count the RR in 60 seconds. 1 inhalation and 1 exhalation are counted as 1 cycle. When abnormal breathing pattern is noted, use the next 60 seconds to carefully observe the characteristic of the client's respiration. And note the rate, deep rhythm, and character of the respiration. Refer any abnormal findings or any complaints of the clients. Example, difficult of breathing. Thank you. Next is the blood pressure. Refers to the force of blood against the arterial walls. Maximum blood pressure exerted on the walls of arteries when the left ventricle of the heart pushes blood through the aortic valve into aorta during systole. First is you need to position the client approximately and allow 10 to 15 minutes rest and the patient is engaged in a strenuous activity before the BP assessment. Fold the patient's shirt, sleeves, or gown up to the shoulders, making it sure it is secured and will not fall the brachial area. Ask the patient not to speak when BP is being measured. Smoothly and evenly apply the cuff with its lower border located at about 2.5 cm above the antecubital space. Ensure the tube is placed in line with the brachial artery. Measure the cuff and snugly fitted by the inserting your fingers into a BP cuff. Position oneself so that the manometer is vertically at eye level. Observation should not be farther than 1 meter. Insert the earpiece of the stethoscope in your ears so that they tilt slightly forward. Be sure sounds are clear, not muffled. Ensure that the stethoscope hangs freely and does not contact with any object. Warm the diaphragm of the stethoscope and locate the brachial artery and place the diaphragm of the stethoscope over the brachial folds. Secure the chest piece by placing over the palm to non-dominant hang over it. Close the valve of the pressure valve to clockwise until it is tight. Quickly inflate the cuff until the last sound, then add 30 mmHg. Slowly release and open the pressure valve and slowly manometer gauge to full at a rate of 2 to 3 mmHg per second. Continue to deflate the cuff, noting the point at which sound disappears. Listen for 10 to 20 mmH after the last sound, then allow remaining air to escape quickly. Remove the cuff from the patient's arm and assist the patient to assume comfortable position. Cover the upper arm. It was previously closed. Discuss the findings to the client and do health teaching as needed. Sanitize your hands to prevent cross-contamination. And documentation chart in PRBP sheet according to hospital policy and report the abnormal findings of vital sign. Report any alteration, observable sign and symptoms of patients and patient's reaction. And that's all for today.